Welcome to AUA Leadership in Business, an official podcast of the American Urological Association.
Welcome to the AUA Leadership in Business podcast, where urologic professionals experience the practical application of business acumen essential for success in today's dynamic professional landscape. I am Dr. Micheal Darson, and in today's episode, we will discuss trainee leadership opportunities in the AUA. Joining me today for this discussion is Dr. Kevin Koo. Dr. Koo is an associate professor of urology at Mayo Clinic in Rochester, Minnesota, where he specializes in medical and surgical management of urinary stone disease. He has been a member of the AUA since 2012 and has been an active participant and leader in many AUA programs. He is the former chair of the AUA Residents and Fellows Committee and created the committee's annual essay contest, now in its 7th year. Dr. Koo is a nationally recognized leader in health policy and advocacy and was a founding member of the AUA Political Action Committee Board of Directors. He is a former AUA Holt-Grew Legislative Fellow and is chair-elect of the AUA Legislative Affairs Committee. Dr. Koo also serves as an online content assistant editor of the Journal of Urology and Urology Practice. Later this year, he will travel to Japan as an AUA Global Exchange Scholar and serve as an ambassador for leadership and collaboration with the Japanese Urologic Association. Dr. Koo, welcome to the podcast.
Thank you, Dr. Darson. It's a pleasure to be here with you all.
Well, I'm really looking forward to this topic because, I've had my own journey through AUA committees and have really enjoyed participating in a number of them. So looking forward to hearing your perspective. So let's go ahead and get started. What do you think the need for leadership in education and development among urology trainees is currently?
Well, I think that this is an area that there is a dramatic need and a critical need for our urology trainees at the undergraduate, medical student, resident, fellow, and early career urology levels to have a resource and to understand and grow into their potential as leaders. I think we as urologists have always sought out young surgeon leaders in our trainees and when we recruit students into our residency and fellowship programs. But the need for structured education and experiential opportunities to really understand what your potential is, how to make the most of your leadership, and seek new opportunities to expand that leadership and those skills. I think it's a really important role that the AUA has and can play. And I'm delighted that as part of our Leadership in Business podcast and our exploration of those opportunities, that today we're getting to highlight the many, many opportunities that young urologists can seek out this education and can learn to spread their wings.
Well, it's important for residents, I think, to get involved because we expect them to be leaders at some point, right?
Exactly right. We both know, and anyone who's worked with early career urologists knows that there is an innate leadership that is an expectation. As surgeons, we are naturally leaders of our operating rooms, and in clinic, we are leading the management and care of our patients, often for many years at a time. And so, whether explicit or simply expected to occur naturally, I think there is an expectation about leadership education, leadership development, and then the performance of leadership qualities. And I think that those skills are critical to bridging the transition into practice. I think some of the sometimes unwritten curriculum is how do we make that transition and how do we go from following the instructions and the guidance of our attendings to then becoming attendings ourselves and being the leader of interprofessional teams. And I think that transition is sometimes a stark reminder of how much responsibility and authority is afforded to us. So I think these unmet needs in leadership education and development can really be met through experiences, through learning by doing, watching leadership role models, and understanding how we can make the most of our training programs and our early career period to guide our own leadership development. And I think the AUA serves as a tremendous resource for leadership training and offers early career urologists diverse and intensive experiences in leadership.
So there are several excellent points made there. What I would say is, the way residencies are structured, when you're a chief, you're kind of thrust into a leadership position, right? So I think that's a good time for the chiefs to kind of check and see how comfortable they are with leadership. And as we're going to point out, I mean, the AUA is a great resource. If you don't feel comfortable as a leader, you've got resources on how to become better at it.
Exactly right. I think everybody comes to that critical chief residency year with different personal experiences and also their own comfort in leading teams. Everyone has leadership blind spots. We know that. And my own experience in residency was that I often relied on the strengths, the complementary strengths of my co-residents to so that we could be a strong chief leadership team. But I think as everyone goes through that journey and transitions to being a chief and then understands their own leadership style when you're being tested every day, we can all get a better understanding of what we excel at and maybe what are the areas of leadership and organizational management where we struggle a bit more. And those are the opportunities that I think we can identify those growth potential, and then seek ways of strengthening our skills and finding opportunities that we can become stronger and better leaders into the rest of chief residency and certainly beyond.
Yeah, great points. I think that residency, uh, chairman and directors of residency programs, a lot of times they say, okay, you're lacking some leadership skills, but then maybe don't give the resources to improve them. You don't just say, hey, be a better leader, because sometimes it doesn't happen without help, right? So that's really good points. So let's talk about kind of your personal journey. You participated in many AUA opportunities, from the Residents and Fellows Committee to the Holt Group Fellowship to editorial leadership roles in the AUA journals. What attracted you to these opportunities, and how did you get your start?
Thanks for that question. In looking back at my own journey through urology, when I started residency and now as an early career faculty member at Mayo Clinic, in reflecting on that, I realized how innate and how interconnected my urology career has been with the AUA and how many opportunities being part of the AUA, being active in the AUA has been how powerful that's been for me to not only grow as a leader, but also to feel like I was contributing something just beyond my own clinic or my own department or my own institution. And I think being part of something bigger, that feeling of leading and of having this momentum and this energy that comes with everything you do is so energizing. And I'm so glad that the AUA has been part of my journey, as I hope it can be for so many of our contemporary trainees and young urologists. What I found in in being part of these opportunities with AUA is that urology is a really small community in the best way. It means that there are always opportunities to meet like-minded people. And one thing I've gained most from being active in the AUA is the opportunity to engage with and learn from leadership role models whom I may not have encountered in other ways or until later parts of my career. So, for instance, being involved in public policy and advocacy, which is such an important part of what I do and my professional identity, engaging with advocacy leaders, engaging with urologists who have dedicated their careers to being on the forefront of public policy and helping to ensure that the practice of urology remains solvent, remains capable and nimble, and that policies speak to the needs of our patients. Those engagements and those interactions have been so transformative to me in seeing how I could do it, how I too could weave public policy and advocacy into a career, and how I could draw on my own professional experiences to give back to the practice of urology, to give back to the AUA and speak on behalf of urologists and our patients. And so discovering these opportunities to make change, I think has been so important and powerful because it allows you to see the different ways in which you can use your own skills and interests to serve others. And I think fundamentally that's why we got into urology, is because we recognize there are certain skills and talents we have been blessed to have been given that we want to use on behalf of helping others and helping our patients. So I think when I think about the work that we did on the residents and fellows committee, right, trying to represent the interests of young urologists, trying to highlight the needs, the training needs, the leadership development needs, the well-being needs, uh, through that committee and through our representation. That was one way while I was a resident that we could understand what was going on nationwide, and joining together with other residents and saying, here are things we're facing in our program. Are these similar to the needs that you have? I mean, that is advocacy. That is a way we can exert our leadership and our experience to make change. And the AUA has been so responsive in many ways to allowing that to happen. You mentioned the essay contest that the Residents and Fellows Committee has now organized for the past 7 years. I was fortunate to start that essay contest with my co-committee members, and that program was a response and a proposal we made to highlight the voices of our talented resident colleagues who might not be the ones necessarily standing at the podium giving a presentation at AUA, or be the ones publishing in the Journal of Urology, but who had ideas and had experiences that were just as valid and just as important to share with our community. And so for the past 7 years, the Residents and Fellows Committee has offered this program and has now honored and recognized over 2 dozen young urologists who have shared such diverse voices and experiences that remind us, even when we are beyond training, of why we got into urology to begin with and what the future can hold, both the bright horizons as well as the ways we can continue to grow and improve our field. So I think those are ways where being part of the AUA has innately been my own personal leadership education, and where just getting involved and participating can really teach you things and show you your own abilities and strengthen your leadership education.
That your enthusiasm is infectious. I mean, it was so well stated. My own experience, I first started feeling that giving back, kind of feeling, and I was kind of caught up in it, and it felt so good to be part of a community. And then you start doing more and more committee work, and then you find out that, hey, I'm really making a difference here for my patients, for my colleagues. And it just builds on itself, and it becomes a bigger and bigger part of your life. And I was once asked, well, doesn't all this committee work like burn you out? And I'm like, I think it's actually causing me not to burn out.
I completely agree with you. I think doing committee work, when you find a mission and you're working with people who care about those things and trying to work around problems, find practical solutions that can improve the practice of urology, that can help our colleagues run their practices more efficiently, more effectively, I think that's tremendously empowering. And for me, going to meetings like the AUA annual meeting or the AUA summit in Washington, D.C. every year, in a way, that's my anti burnout. That keeps me focused on what matters. That helps me build relationships that can give me purpose, and I think that exactly as you're saying, that idea of being part of something that may be bigger than yourself, that giving back mission, it's so profound, and I think it really kind of gives back to you in spades.
Yeah, I completely agree. Let's talk about the opportunities that the AUA offers to current trainees and young urologists. And what are the ways that medical students, residents, and fellows early in their career as urologists go to find the leadership resources? And
I think this is the heart of what we're talking about today. And the first thing I want to say is that there is a role and a place for everyone in our community. And so these opportunities we're going to talk about today, this is not an exhaustive list, and nor is it the final list. These opportunities continue to evolve, and the AUA has put in a lot of time and energy to develop these opportunities for designed especially for early career urologists. I think one of the best examples of that is the leadership in business education through this podcast, through many programs that the AUA now is running. That's a great way for young urologists to start out and think about leadership. What is it? How do we exert leadership as when we're still early in our careers? Where does leadership find its footing in the daily practice of medicine? That understanding, I think, is foundational to understanding our own role and how we are growing as leaders throughout our careers. But beyond that, there are specific programs and opportunities for medical students, for residents, for fellows, and young urologists. And this list has really proliferated in the past 5 to 7 years. And I'm so proud of the AUA for devoting these resources, the staff, the time, the financial resources, certainly, to making these programs possible. So we can start beyond the Institute for Leadership and Business. We can start with some of the programs in our membership department. So the Residents and Fellows Committee, as we've been talking about already, is the committee that represents the interests of residents and fellows. Every section of the AUA, all 8 sections, has a representative to the committee, as well as our colleagues in Canada and Mexico, and several other specialty and affinity groups as well. And the committee puts on the very popular Residents Forum at the AUA annual meeting, and it sponsors the annual essay contest, the theme of which changes every year and highlights what matters to residents and fellows, the landscape of training in the 21st century, and other topics that our colleagues have a lot to share. There's also a work group, a membership work group that's specifically for medical students. And this is pretty new. When I remember when I was a medical student and became a medical student member of the AUA, we didn't really know how to be part of the AUA besides perhaps going to the annual meeting and using the medical student curriculum, which is excellent and which I recommend to every medical student who comes to work with me. But the medical student membership work group, it has a mission of growing a strong network of engaged medical students to help the AUA understand medical student needs. So this is a work group that's dedicated to giving feedback to the AUA so that the AUA can provide better outreach and communication with medical students while supporting diversity efforts as well. So there are 8 medical students who are voting members of this work group. And it's a fantastic way for students to get to know the AUA better, but then also contribute to these programs to serve the needs of medical students as they get ready for a career in urology. Finally,
yeah,
there's also a global residence leadership retreat, which is a very new program, but which has so much promise. One of our residents attended this retreat at a recent AUA annual meeting, and to see residents from around the world come together to understand their own leadership development, but also leadership education and how they could bring that education to their programs. It was truly inspiring. I'm so glad that there is this global leadership retreat that puts the spotlight on trainees and specifically on developing leadership potential within trainees, because this is an example of how creative the AUA can be in disseminating leadership education. And I know this retreat will continue to occur and hopefully will become an annual or at least a regular program, because there's nothing like bringing people together to talk about challenges and to be inspired by what's happening in programs around the world.
Yeah, I think that you pointed out some amazing infrastructure that the AUA has helped create. Back in my day, I'm not sure much of this existed. And our kind of daily goal is just put your head down and go. But this kind of ability to start building on your leadership and forging relationships with your colleagues, I think is just it's really awesome that the AUA has done this, and I would highly recommend. I know medical students don't have a lot of time, nor do residents, but this is time well spent. Talk about getting a return on your investment. This is a good example of it for sure. Can you talk a
Absolutely.
little bit about the Legislative Fellow Program?
Yes, this is certainly near and dear to my heart because I'm a proud alumnus of this program. The Whole Crew Legislative Fellowship is a unique program that doesn't exist in many other specialties outside of urology. And it was created about 10 years ago to allow young urologists to have an intensive experience in legislative advocacy. We know that the practice of medicine and the healthcare policy landscape are constantly evolving. And if we, as a profession, as a specialty, as an organization, and as individuals, if we don't keep on top of what's happening in this space, and if we don't lend our voice to represent our colleagues, our practices, and our patients, then those critical decisions governing the business of medicine and the practice of medicine in this country and beyond will be made for us, will be made by entities and by people who may not have our patients' best interests at heart because they're motivated by other factors, but because they're not on the front lines of patient care every day like we are in our clinics and our ORs. So the Whole Crew Legislative Fellows Program is is a program that allows young urologists access to some of the highest levels of decision making in public policy and advocacy at the AUA, from the Public Policy Council all the way down through various committees and subgroups. And the crown jewel of this experience, the capstone of this experience, is an opportunity to be embedded within the legislative system. So when I was the Whole Crew Fellow, I spent a month and a half on Capitol Hill with U.S. Senator Bill Cassidy of Louisiana. And Dr. Cassidy is a physician and has served in communities that many of us also serve, and has called upon his medical background, knowledge, and experience in the healthcare system to try to make healthcare better, more affordable, more accessible. And so this opportunity to learn from not only a physician member of Congress, but someone who's a leader in healthcare policy really shaped my understanding of what we as individual clinicians can do and how important and how loud our voice can be, because we are the front lines and we understand what's happening to our patients, and how challenging sometimes getting timely care can be. So, for any young urologist who is interested in exploring the idea of being an advocate and using their voice in the political and policy process more, this program really is second to none, and it certainly has transformed my career and my engagement in this arena, and I know will continue to do so for many years to come.
And our legislators, they want to hear from us, because when you walk into a senator's office and say, hey, I represent these zip codes with patients and all these, I mean, that's something that gets their attention, because that's their constituents, right? And you're part of the voice for that.
Exactly right. And I've been attending the AUA Summit, our annual gathering in Washington, D.C., where we talk about the policy issues our practices are facing, and we go to our lawmakers and be that voice. I've been going to the AUA Summit for many years, and every time we walk into a lawmaker's office, the first thing they say is, thank you for being here and sharing this voice and this experience. We don't hear it enough. We want to hear it more because no one is more qualified than we are to speak on this, to say, this is what I'm seeing in my practice. This is what's keeping me up at night. This is why it's hard to keep the lights on. No one can speak to that better than we can. And so, being an advocate is so valuable and such a good use of our time. And the fellowship program is not the only program for young urologists. There's also a policy and advocacy recruitment work group, which has grown in the past 4 to 5 years to really be a starting point, a powerful and energetic starting point for medical students, residents, fellows, and young urologists to learn more about getting involved, to to identify those policy issues or those advocacy topics that matter most to them, and then to take on projects and make change at the institutional level, but also at the regional and national level. So this program is a great way, and it's very inclusive. It's a great way for early career urologists and trainees to get a taste of what this process looks like, and to understand how they, even at that level, can contribute to the process, which is so important.
So all really good points, and we've outlined how personally and professionally satisfying committee work can be in advocacy. But we've also talked about how medical students and residents have little to no time to engage in this. So obviously, it can be daunting or intimidating to get started. Do you have any advice for trainees getting started on their leadership developmental journey?
I think it's not only common to be to feel intimidated. I think it's understandable. The AUA is a big organization. Uh, I very much remember my first AUA annual meeting, and the predominant feeling was being overwhelmed, um, tremendously excited and energized, but totally overwhelmed. And I think when you look at all the opportunities that are available to young urologists, the ones we've mentioned, but also so many more, the Science and Quality Fellows Program, the Medical Student Education Committee, which also has medical students sit as members on that committee. Uh, so many research opportunities and programs intended to galvanize young urologists as investigators, the Medical Student Innovation Fellowship, the Medical Student Fellowship for Research, the Physician Scientist Residency Training Awards, all of these opportunities. How exactly do you get started? How do you find your way into the AUA? And I think one of the ways to do so is to identify a topic area or a skill area of interest, and to identify either mentors in that topic area, or to find AUA programs that are centered around that. So, for instance, if we have early career urologists who are interested in publications, in understanding scholarly publishing, how does research get disseminated? How do we be part of that process? Maybe one day I want to become a peer reviewer or even an editor of one of our journals. Then there are opportunities there as well. For instance, AUA News, our monthly news magazine, recently launched a medical student column, and medical students on a rotating basis can contribute their opinions and their perspectives on being a medical student, getting started in the career path to urology. And that's been a tremendous way for medical students to take a first step in sharing their voice and getting a taste of what the editorial process is like. There's also the Early Career Editors Program, which recruits early career urologists to become and support associate and assistant editors for the Journal of Urology, and assist in triaging manuscripts, finding expert reviewers, and being part of that scholarship publishing process. So, whatever the topic area or the particular interest, or even perhaps a skill that you're trying to build, there's most likely an opportunity in the AUA that can help. And the goal here, I think, is to figure out how the AUA can augment and can strengthen what early career urologists may already have locally. There's nothing better than having a local mentor, and certainly I count many, many mentors that I've met through my training and now in my career as being so influential in helping me get started and connecting me with AUA programs. So whether those people are at your local department or within your section, another great way to get started is at the sectional or regional level. Finding those local resources and pairing them with AUA programs, I think, is a tremendous way to get started and to understand what's available. Sometimes getting started is as simple and as difficult, seemingly difficult, as saying, I have an interest, and raising your hand to say, how can I get involved? How can I participate? But I want to encourage all of our listeners to be bold and to be confident and to reach out to someone. And I'm sure either of us would be happy to connect people to our networks as well, to express an interest and to participate and to stay involved even beyond training.
All of those are really excellent points. I mean, I guess one of the pieces of advice that I would add to that is, every journey starts with that first step. It doesn't have to be a jump or a giant step. It can just be, hey, this something at this section interests me, and get started that way. And as you've outlined very well, the AUA has provided an infrastructure for you to take a big step, a little step, but it's really that first step to get started that's so important that you've highlighted.
Exactly right. Exactly. I think taking that first step can always seem like the hardest, but as anyone who's hopefully listening to this podcast knows, we are a small community and we're a friendly community. And I think that's one of the best parts of AUA is to get to know our colleagues and to know that there's people across the country who are willing and wanting to help.
Absolutely. Well, I think we've covered a lot of ground today about the leadership opportunities for trainees in the AUA. What's next for you in your leadership journey?
Well, I'm excited to continue being part of the AUA community and to continue my own leadership journey through the many programs we've discussed today. Later this year, I'm really excited to be an AUA, JUA, Japanese Urological Association Global Exchange Scholar. And this is a program that the AUA offers to urologists with its collaboration and partnership of many other urological associations around the world. I'm excited to go and spend 3 weeks with our colleagues in Japan to understand how their health system works, how urological care there is delivered, how urologists are trained in Japan, and to be part of the Japanese Urological Association annual meeting, and to represent the AUA and to be an ambassador for American urologists there. It's a great honor to be selected, and I'm looking forward to building and strengthening our global connections with urologists abroad. I'm also excited to have been recently named the chair-elect of the AUA Legislative Affairs Committee. As you know, political advocacy and public policy are really important to me, and I'm very honored to be selected to serve in this role and to have a hand in helping to shape and influence the legislative priorities that the AUA supports, where we put our time and our money, how we engage with members of Congress to tell them what's important to urologists and to our practices and our patients. So I'm looking forward to expanding my leadership in that committee as well. And to continue to serve, ultimately, to serve our community, to serve our patients and practices by hopefully making urology easier to access, safer, more cost efficient, and effective, and ensuring that public policy works for urologists and works for medicine at large.
Dr. Koo, thank you very much for sharing your time and expertise with us today.
It was a pleasure to be here, Dr. Darson. Thank you so much for having me and for allowing the AUA to serve the leadership and business education needs of our all of our colleagues in the community. It's a pleasure to be part of this community, and I look forward to continuing to help and to serve.
And thank you to our audience for joining us on the AUA Leadership Business Podcast.
Invest in your leadership and business skills at AUA 2024 with the Institute for Leadership and Business track. The ILB track features a total of 7 live courses offered from Thursday, May 2nd through Sunday, May 5th, with additional on-demand content to supplement. Whether you are starting your career, seeking career advancement or professional development, or looking to master the business challenges facing today's urology practice, the ILB track offers education to support your needs and professional growth. To accommodate the busy and robust schedule of AUA 2024 and to ensure that participants have access to all programs in the ILB track, each session will be recorded and can be accessed on demand, unless otherwise noted. Visit auanet.org/AUA 2024 to learn more and add the ILB track to your annual meeting registration. See you in San Antonio.